My name is Sierra Barr. I'm with Fort Hays State University, and I'm doing a presentation on rural health grant opportunities in my community. A grant is a bounty, contribution, gift, or subsidy in cash or kind bestowed by the government or other organization called the grantor for specified purposes to an eligible recipient called the grantee, which are usually conditional upon specific qualifications and ability to maintain. Grants have the ability to provide expanded and sustained national investments in prevention and public health, improve health outcomes, and enhance quality of health care. It's particularly important in rural areas. Rural statistics in Kansas show that in 2016, 433 individuals lived in rural areas. The poverty rate for rural Kansas is 13.7 compared to 11.4 in urban areas. Food insecure households averaged at 14.5, and the unemployment rate in rural areas is 4.3 compared to 4.1 in the urban areas. This is important because it impacts health disparities. Rural areas have a higher incidence of disease and disability, increased mortality rates, lower life expectancies, higher rates of pain and suffering, reduced access to health care, and access to fewer primary care providers. Statistics show that less than 8% of primary care providers and surgeons are located in rural areas. Also, distance can be a factor in whether or not individuals receive adequate health care. In addition to this, with the lower income and the unemployment rate, fewer individuals have health insurance through their employers. The REACH Healthcare Foundation is a foundation that provides grant monies specifically for rural areas as well as areas concerning mental health, primary medical, safety net healthcare services, and oral health. It was established in 2003 with proceeds from the sale of Health Midwest, which at the time was a regional nonprofit healthcare organization that was purchased by Hospital Corporation of America. The foundation was approved by the IRS in May of 2004, and it received nearly $100 million in initial assets. As previously stated, REACH funding focuses on three primary areas: oral health, mental health, and primary medical safety net healthcare services. It also invests in public policy and advocacy, special projects, and rural health. In 2016, $4.4 million was invested in grants, and $52.3 million has been invested in programs and initiatives since 2005. The mission, vision, and values of REACH Healthcare Foundation. REACH's mission is to ensure access to quality health care by all underserved and poor individuals within the community. Its vision is to advance equity in healthcare coverage, access, and quality for poor and underserved people. Values include serving as a leader for healthcare change, fostering an environment of positive change, and demonstrating respect and appreciation for all backgrounds and points of view. This is the basic breakdown of REACH Healthcare Foundation's theory for change. With the mission and vision at the top, the long-term impact is to achieve health equity by reducing barriers to coverage and care. As you can see, there are multiple targets, specific outcomes, and very detailed strategies for achieving these goals. The REACH Foundation's geographic location, it services areas in both Kansas and Missouri. For Kansas, it is specific to Allen, Johnson, and Wyandotte counties, and in Missouri, it's Cass, Jackson, and Lafayette counties. The Kansas City area is also included. REACH does state that they will fund policy and advocacy organizations that work beyond those areas, provided their work ultimately benefits the residents in their service area. Based upon this criteria, grants would be eligible to fund projects in my area because it is pertinent to Kansas, and it would benefit individuals in those primary counties of focus. The subject area-wide, REACH offers funding in both rural health and mental health, both of which fall under my subjects. Grant types include initiative, solicited, expansion, capital, joint venture, policy and advocacy, discretionary, capacity, core operating, and program. Areas of interest include mental health, oral health, safety net, systemic, and other. Examples of grants specific to mental health. There are multiple grants that have been awarded even in 2015 that are specific to mental health. Grants have been provided that allow funding for increased staffing, obtaining and running electronic health records, outreaches to increase healthcare and enrollment, and expanding networks to address greater needs. One specific grant was granted to Compass Health. It was a capacity grant for $26,300 for the purpose of effectively utilizing iMicrosoft database to support database decision-making of clinical and administrative leaders. Another grant was awarded to Comprehensive Mental Health Services and was granted $30,000 to acquire software and training to improve interoperability with the State Health Information Organization and other health providers. In addition to this, $75,000 was also granted for core operating partnership. Johnson County Mental Health Center, which is located in Kansas, received a capacity grant for $30,000 to support development of strategic plan for community mental health center. Another grant specific to Kansas was awarded to Kids STLC Inc., which is located in Olathe. They received $100,000 in a program grant for support board certified child and adolescent psychiatrist and evidence-based dialectical behavioral therapy with outpatient behavioral health services. This type of grant would be pertinent to my organization, as it is also a mental health center and does do outpatient behavioral services for families and children. The funding level of this institution shows that REACH funds projects centered around multiple areas, including mental health. REACH does not fund projects that are specific to individuals, focus on one disease process, center on medical or clinical research, or projects that are related to operating deficiencies. REACH also does not fund projects related to crisis intervention, suicide prevention, domestic violence prevention, family violence prevention, or healthy lifestyles programs. So while funding would be available on the level of my project, it would not be available for my project specifically, as mine does focus on crisis intervention and suicide prevention, and focuses mainly on one disease process, which is depression. However, it would still be available for my organization as a whole, just not my unit, as my unit is concerned primarily with suicide prevention and crisis intervention, as it is an acute crisis stabilization unit that deals primarily with mental health and issues that relate specifically to suicide and depression, as previously stated. Eligibility criteria for REACH show that you must be in the service areas listed or benefit uninsured or medically underserved individuals in the service areas. Also, if it is something that would apply to these areas or overall benefit these areas, ideas may be submitted and approved. The organization must be tax exempt under the IRS and not a private foundation. Prairie View would still fall under this eligibility criteria because it is a nonprofit organization. Collaborative efforts are eligible to apply provided the applicant organization meets the foundation's eligibility criteria and is exempt under Section 501c3. Also, organizations cannot discriminate on the basis of age, race, color, sex, religion, national origin, disability, gender identity, and sexual orientation in employment practices or policies and procedures concerning services. Organizations must also maintain financial records in accordance with generally accepted accounting principles and obtain an annual audit by an independent certified public accountant each fiscal year. According to REACH, the REACH Foundation awards grants to tax-exempt organizations and public agencies. Organizations without 501c3 status or other tax-exempt recognition must partner with a tax-exempt organization to serve as a lead agency and fiscal agent. The Foundation does not award grants or financial assistance to individuals or for-profit entities. A timeline has also been established. According to the REACH guidelines for obtaining grants, the Foundation offers one competitive grant cycle each year for program grants. REACH explains that the grant guidelines are released in August and grant decisions are made by November of each year. However, organizations may apply for a capacity, CO discretionary, or advocacy grant throughout the year. Specific to my project, if my project did not otherwise not meet criteria, it would fit the timeline as it is granted each year, as long as information was submitted in a timely manner by August and met criteria with everything else that is required, grants would be eligible.